I think the vision for WSU Spokane in the health sciences is to have a multidimensional campus that teaches all aspects of healthcare.
Nursing, physician assistants, dentistry, physicians, being part of this campus is pretty special because we have all of those different disciplines represented as students. So interacting with the other students is an interesting experience that you don't necessarily get at every other medical school.
We do a preceptorship, which is 3 hours every week spent with a local physician. In that setting, we see what the role is of the physician, the nurse, the pharmacist, and other allied health jobs.
It's the clinical environment of Spokane combined with all the university resources that really make this a fabulous place for training medical students.
The physicians and the healthcare professionals in this community have really worked incredibly hard to make sure we have a good experience and opportunities to get out in the clinics, seeing patients, working with physicians, and so we might get a little advantage.
And I'm very much biologically oriented, what's going on in the brain, and often what's going on in the brain of a mouse as opposed to a human brain. But in the teaching context, we have that expertise combined with some MDs who are teaching, so they have actually worked with patients and can translate the things that we know about biology that have been learned in rodent and other animal studies into something that's actually relevant to someone who's going to interact with patients, diagnose patients, and ultimately treat patients.
Their research isn't necessarily what we have to learn for class, but oftentimes they will add that to their class presentations, which is very interesting to the students to see what the cutting-edge research is about what we're learning.
I wanted to have an association with a teaching environment to give research more relevance and to help me understand the relevance.
One example that I think has really demonstrated to me the importance of working together as a team is our House of Charity clinic that my classmates set up this year. It's a clinic for homeless people. Every Saturday morning we have 2 students there and a doctor who has volunteered his or her time, and there's a nurse there and sometimes a pharmacy student. I got to interview patients and listen to their hearts and lungs, so it was great practice. I've done it twice and it's been a highlight of my year.
The environment that WSU's provided with the faculty and the close, small group of students that we have really is facilitating to getting your foot in the door in medicine.
Growing healthcare sciences on the River Point campus would benefit the Spokane area in many different ways.
We've got a world-class human sleep research laboratory here, and I'm now associated with them doing the genetic studies that wouldn't be possible in virtually any other context.
The research productivity of our campus has the benefits of touching on the community, improving healthcare in the community, and also just generating new technologies and new industries really in the Spokane area.
There's a lot of great things happening here.